Hi guys, Billy and Zuri here, and today we are going to be talking about rotator cuff tears and injuries. We're also going to be mentioning the sits muscles.
Sits muscles, the ones I'm using right now.
No, Zuri, unfortunately not the ones you are using right now. We are going to be mentioning the sits muscles of the rotator cuff. The sits muscles include the subscapularis, infraspinatus, teres minor, and supraspinatus. We will now take a look at the rotator cuff anatomy. The supraspinatus. The origin of the supraspinatus is the supraspinous fossa of the scapula. The insertion, the greater tubercle of the humerus. The action, abduction of the arm. The nerve supply is the suprascapular nerve. The arterial supply is the suprascapular artery. Clinically, the tendon of this muscle is one of four that forms the rotator cuff of the shoulder joint. Repeated abduction and flexion can lead to wear and tear, causing injury or rupture of this cuff. Up next, we have the infraspinatus. The origin, the infraspinatus fossa of the scapula. The insertion, the greater tubercle of the humerus. The action, external rotation of the arm. The nerve supply, the suprascapular nerve between C4 and C6. The arterial supply, the circumflex scapular artery or the suprascapular artery. Clinically, the tendon of this muscle is one of four that forms the rotator cuff of the shoulder joint. Repeated abduction and flexion can lead to wear and tear, causing injury or rupture of this cuff. Lesions of the suprascapular nerve can result in weak shoulder rotation and posterior lateral shoulder pain. Up next, we move to the teres minor, the origin being the upper 2/3 of the lateral margin of the scapula, the insertion, the greater tubercle of the humerus, the action, external rotation and adduction of the arm, the nerve supply being the axillary nerve, and the arterial supply, circumflex scapular artery and posterior circumflex humeral artery. Please take note that we will not be mentioning the clinical notes of the teres minor or the subscapularis, as it's exactly the same as that of the supraspinatus and the infraspinatus, this being due to the fact that the sits muscles form part of the rotator cuff complex. Last but most certainly not the least, we will take a look at the subscapularis. The origin is the subscapular fossa of the scapula, the insertion, the lesser tubercle of the humerus, the action, internal rotation and extension of the arm. The nerve supply is the subscapular nerve and the arterial supply is the subscapular artery.
Some of you might be wondering, what is a rotator cuff tear? It is a rip in the group of muscles and tendons that stabilize the shoulder joint and allow you to lift and rotate your arms.
Rotator cuff tears include partial tears, acute tears, chronic tears, and degenerative tears. Rotator cuff tears are quite common in sports like tennis or baseball. Risk of injury also increases with age. When it comes to patients older than 80, 50% of these patients will have a rotator cuff tear, for which majority of them will be asymptomatic. Studies found that over 300 million people have a rotator cuff tear per year. It's also been found that there is a 75% success rate for non-operative treatments like physiotherapy.
First up, we have the empty can test. Lift your arm at 20 degrees from the sagittal plane and 90 degrees from the frontal plane. If someone applies pressure to the top of this arm and you experience any pain or your arm goes down quickly upon trying to resist this pressure, you know that you might have a possible rotator cuff injury. For the next test, bend your elbow 90 degrees and keep your upper arm close to your thorax. Someone applies pressure towards the sagittal plane on the outside of your forearm. If you can resist this pressure, good. If not, if you experience any pain, this might indicate a rotator cuff injury. The last test is called the lift arm test. Put your hand on your belt level behind your back. Your elbow should be about 90 degrees flexed. In a good arm that has no pathology, you would be able to easily lift away this arm from your belt. If you do have a possible rotator cuff tear or injury, you will struggle to get your hand to your belt level behind your back in the first place and experience severe pain upon someone trying to maneuver you into that position.
For the pendulum exercise, hold onto a chair and lean over to let your painful arm hang down. Keep your arm as relaxed as possible and move your body so your arm can swing like a pendulum back and forth or in a circle. For the scapular retraction exercise, keep your neck relaxed and keep the shoulder blades squeezed together, holding it for about 1 to 2 seconds and repeating it 15 to 20 times every couple of hours. The serratus punch exercise targets the serratus anterior muscle. Lie on your back and bring your arm to 90 degrees and reach up to the ceiling like you're slowly punching the ceiling. Perform this exercise 3 times a day with reps of 10 to 12 times. For the wall slide, slide your arms up the wall while keeping your neck relaxed and only going as far as you can without feeling pain. Remember to keep your arms relaxed as you slide back down. Repeat this exercise 10 to 15 times and repeat the set 2 to 3 times a day.
So, we actually didn't do too bad. I mean, we didn't even stutter.
Yeah.
Flashback.
Oh, guy.
End of flashback.